Happy Sunday. This month, it was HIV/AIDS Awareness Month. They had Awareness Day earlier in December. And so I thought this would be an opportunity to go over some of those things as it relates to HIV/AIDS. I'm going to do this in a two-part segment because I don't want to overwhelm, everyone with so much information on one Sunday, and also want to be mindful of the time as well. So let's talk about it. So what is HIV? HIV stands for Human Immunodeficiency Virus. It's a virus that can only infect humans and leads to the weakening of the immune system. The immune system is the body's system for fighting disease. When it's compromised or weakened, a person becomes vulnerable to all kinds of bacteria, viruses, or other agents that cause disease. HIV is the virus that causes AIDS. It damages your immune system, making it easier for you to get sick. What causes HIV? HIV is caused by a virus. It can spread through sexual contact, illicit injection drug use, or sharing needles, contact with infected blood, or from mother to child during pregnancy, childbirth, or breastfeeding. HIV destroys what's called your CD4 T cells, which is white blood cells that play a large role in helping your body fight disease. The fewer CD4 T cells you have, the weaker your immune system becomes. It is important to note, you cannot have AIDS without being infected with HIV. But people can and do live long lives on treatment with HIV and never develop AIDS. Once you have HIV, the virus stays in your body for life. The risk factors. Anyone of any age, race, sex, or sexual orientation can be infected with HIV/AIDS. However, you're at greatest risk of HIV and AIDS if you have unprotected sex, have STIs, use illicit drug use. Signs and symptoms. HIV can be spread to other people whether or not you have symptoms or feel sick. That's the main thing that people need to be aware of. You may not necessarily know someone have this because some people may not feel sick at all. Symptoms are the same in both men and women. It can be years before symptoms of HIV make you feel sick, so many people may not know that they have it. That's why I'm going to employ everyone. You can have routine HIV testing as it is important. Common HIV symptoms, specifically for women, changes in menstrual cycle, heavier or lighter periods, or bad PMS. Lower belly pain due to pelvic inflammatory disease, pain during intercourse, and vaginal yeast infection frequently. Here are pictures of some of the signs and symptoms that people do get. The fever, the sore throat, the swollen lymph nodes, rash, muscle aches, fatigue, chills, mouth ulcers, just to name a few. So what are the signs and symptoms? Some other signs and symptoms? The symptoms of HIV and AIDS vary depending on the phase of the infection. So they have 4 phases or stages. The primary infection, acute HIV, some people infected by HIV develop what's called flu-like illness within 2 to 4 weeks after the virus enters the body. This illness, known as primary acute HIV infection, may last for a few weeks. Possible signs and symptoms include the fever, the headache, the muscle aches that I just spoke about, the joint pain, the rash, the sore throat, painful mouth sores, swollen lymph glands, mainly on the neck, diarrhea, weight loss, cough, night sweats. These symptoms can be so mild that you might not even notice them. However, the importance of virus is your bloodstream. However, the amount of virus in your bloodstream, the viral load, is quite high at this time. As a result, the infection spreads more easily during primary infection than during the next stage. The next stage is called a clinical latent infection or chronic HIV. In this stage of infection, HIV is still present in the body and in white blood cells. However, many people may not have any symptoms or infections during this time. This stage can last for many years if you're receiving antiviral therapy. Some people develop more severe diseases much sooner. The next phase, symptomatic HIV infection. As the virus continues to multiply and destroy your immune system, the cells in your body that helps fight off germs, you may develop mild infections or chronic signs and symptoms such as the fever, fatigue, the lymph nodes, Often one of the first signs of HIV infection is the swollen lymph nodes. Diarrhea, weight loss, the oral yeast infection, what's called a thrush in the person's mouth. That makes it difficult for them to also eat and swallow. Shingles, herpes zoster, and pneumonia. Then you have the progression to AIDS. When AIDS occurs, your immune system has been severely damaged. You'll be more likely to develop diseases that wouldn't usually cause illness in a person with a healthy immune system. These are called opportunistic infections or opportunistic cancers. The signs and symptoms of some of these infections may include sweats, chills, recurring fever, chronic diarrhea, the swollen lymph glands, persistent white spots or unusual lesions on your tongue or in your mouth, persistent unexplained fatigue, weakness, weight loss, skin rashes, or bumps. What tests are available to diagnose HIV/AIDS? There are 3 types of HIV tests: the antibody test, the antigen-antibody test, and the nucleic acid test. Antibodies are produced by your immune system when you're exposed to viruses like HIV. Antigens are foreign substances that cause your immune system to activate. If you have HIV, an antigen called P24 is produced even before antibodies develop. HIV tests are typically performed on blood or oral fluid. They may also be performed on urine. Again, there are many HIV tests that are quick, free, and painless. They have the HIV self-test, and you can do in-person HIV testing. Thank you for your time. Thank you for your attention. I hope this was quite informative. We will continue with part 2 next Sunday. God bless and enjoy the rest of the week.